Okay, let's move on to the Dr. Oshitari. Dr. Oshitari is an associate professor of the ophthalmology in Chiba, and he's going to talk about the pathogenesis of neural cell death in diabetic retinopathy.
Next, please.
Okay. So thank you for inviting us and giving a chance to introduce our study. The topic of this talk is pathogenesis of neuronal cell death in diabetic retinopathy. Recent study indicates that both vascular abnormalities and neuronal abnormalities are associated with the pathogenesis of early stage of diabetic retinopathy. Vascular abnormalities include pericytal loss, tight junction protein downregulation, and basement membrane thickening. All these changes are related to increased vascular permeability. On the other hand, the representative change of neuronal abnormalities is neuronal cell death. Neuronal cell death is an reversible change, and it's directly related to vision loss of diabetic patients. Because the final goal is to protect visual function of diabetic patients, neuroprotective and regenerative therapies should be established. The contents of this talk are OCT analysis of patients with early stage DR, and immunohistochemical analysis of neuronal cell death in retinas of diabetic patients. And finally, I will introduce the basic study regarding neuroprotection and regeneration and diabetic conditions in 3D tissue culture system. First, we will examine the macula and retinal nerve fiber layer RNFL thickness in patients with early stage of diabetic retinopathy. This slide shows representative OCT findings of patients without diabetic retinopathy. Red color shows thinner macula compared to the normative data. In both non-DR patients, the central macula thickness was significantly thinner than normal subjects. This slide shows the result of macula and RNF thickness of normal subject, patient without DR, and patient with simple DR. In patient with non-DR, the central macula thickness was significantly thinner than normal subject. However, in patient with SDR, the central macula thickness was significantly thicker than normal subject. These results indicate that early reduction of macula thickness is due to neuronal degeneration, and the early neuronal change is masked with the increase in macula thickness, but associated with vascular leakage. On the other hand, in patient with SDR, RNFL thickness was significantly thinner than normal subject. These results indicate that the RNA thickness was significantly thinner in eye with a longer duration of DM. In summary of the OCT study, neuronal abnormalities may precede vascular abnormalities in early DR, and the neuronal abnormalities may progress with increase of DM duration. Immediately after publishing a paper, the other group demonstrates that the inner plexiform layer is the thinnest in patients with early stage DR. The inner plexiform layer consists of retinal ganglion cell dendrites. So neurites means axons and dendrites. Now, neurites of retinal ganglion cells are affected in the early stage of the year. We define these changes as retinal ganglion cell neuropathy because not only optic nerve axons, but also cell bodies and dendrites are affected in the early stage of the year. To distinguish with optic neuropathy, we use the term retinal ganglion cell neuropathies for expressing neuronal abnormalities of diabetic retinopathy. The main goals of our study is to study why retinal ganglion cell neuropathy develops and how retinal ganglion cell neuropathy is rescued. The first purpose is to study why retinal ganglion cell neuropathy develops in diabetic retinas. For this purpose, we performed a human retinal study. 5 pairs of age-matched normal and diabetic human eyes were used for this study. We prepared cross-sections from retinal samples and stained with fluoride B, a degenerative neuron marker, and co-stained with Bach's active forms of caspase-9 and caspase-3. This slide shows representative pictures of Bach's immunostaining of diabetic human retinas. Blue signal shows DAPI gray, and green signal shows fluoride B positive signals, and red signal shows Bach's immunopositive signals. And now, Bach's immunopositive signals coexisted with fluoride B positive signals. Thus, Bach's expression is increased in degenerative neurons of the ear. This slide shows representative picture of caspase-9 immunostaining of diabetic human retinas. Again, red signals show active form of caspase-9 immunopositive signals. Now, caspase-9 immunopositive signals coexisted with fluoride B positive signals. This means active form of caspase-9 expression is increased in degenerative neurons of the ear. This slide shows representative pictures of caspase-3 immunostaining of diabetic human retinas. Red signals show active form of caspase-3 immunopositive signals. Now, caspase-3 immunopositive signals coexisted with fluoride B positive signals. Thus, active form of caspase-3 expression is increased in degenerative neurons of the ear. This slide shows result of numbers of fluoride B positive and Bach's or caspase-9 or caspase-3 immunopositive cells in the ganglion cell layer of human retinas. In diabetic retinas, the number of fluoride B positive cells was significantly increased compared to control retinas. The number of fluoride B positive and Bach's or caspase-9 or caspase-3 immunopositive cells in diabetic retinas was significantly increased compared to control retinas. These results indicate that mitochondria and caspase-dependent cell death pathway is activated in degenerative neurons of the eye. In summary, in diabetic retinas, fluorojet B positive cells were significantly increased compared to normal retinas. And mitochondrial and caspase-dependent cell death pathway is associated with neuronal cell death of the eye. The next purpose is to establish neuroprotective and regenerative therapies for retinal ganglion cell neuropathy of diabetic retinas. For this purpose, we used three-dimensional collagen gel culture system. Briefly, we killed the animal under anesthesia or CO2 inhalation and isolated the retina under the sterile condition and prepared retinal explants 1.5 millimeter from the disc. About total 30 pieces of retinal explants can be obtained from one retina. And we fixed retinal explants in collagen gel and culture in serum-free medium. This slide shows representative pictures of regenerating neurites. Regenerating neurites with close cone are sprouted out from the edge of the retinal explants in a collagen gel. We counted the number of neurites by moving focus point under the phase contrast microscope. And these neurites show Cy1 immunopositive. Cy1 is a specific marker of retinal ganglion cells. Thus, these neurites are derived from retinal ganglion cells. After counting the number of neurites, we fixed retinal explants and prepared cross sections and performed tunnel staining. Blue signal shows stable staining gray, and red signal shows Cy1 immunopositive signals, and tunnel positive cells show green. And after superimposition, tunnel positive cells become cyan blue. Now, most tunnel positive cells show Cy1 immunopositive. This means mainly retinal ganglion cells die by apoptosis in this system. This slide shows the scheme of the cell death mechanisms of culture retinas. After culture, CPOS-AP1 is induced in damaged retinal ganglion cells, and the cell death signals transfer into mitochondria. After that, caspase-dependent cell death pathway is activated. Now, caspase-9 and caspase-3 inhibitors rescue 60% of retinal ganglion cell death. There's 60% of retinal ganglion cell death by apoptosis via mitochondria and caspase-dependent cell death pathway. First, we cultured streptozotocin induced diabetic rat retinas. This slide shows the result of control and diabetic retinas in culture. In diabetic retinas, the number of tunnel positive cells was significantly increased, and the number of neurites was significantly decreased compared to control retinas. This means in diabetic retinas, neuronal cell death is increased and regenerating neurites decreased. This slide shows the box immunostaining of diabetic culture regions. Green signal shows box immunopositive cells. This is control, and this is diabetic regions. Now, in diabetic regions, box immunopositive cells was significantly increased compared to control. This means in diabetic regions, box expression is significantly increased compared to normal regions. This slide shows box Western blot analysis in diabetic regions. In diabetic regions, box protein level was significantly increased compared to control. Again, in diabetic regions, box protein level is significantly increased compared to normal regions. This slide shows neuroprotective effect of neurotrophic factors in high glucose exposed region. In regions culture in high glucose medium, pink bar, the number of tunnel positive cells was significantly increased compared to normal glucose. And in regions culture in high glucose medium supplemented with all neurotrophic factors, the number of tunnel positive cells was significantly decreased compared to resonance culture in high glucose medium without neurotrophic factors. Thus, all neurotrophic factors reduce neuronal cell death in high glucose exposed regions. This slide shows a regenerative effect of neurotrophic factors in high glucose exposed regions. In resonance culture in high glucose medium, the number of neurites was significantly decreased compared to resonance in culture in normal glucose medium. And in resonance culture in high glucose medium supplemented with BDNF, NT4, and citrulline, the number of neurites were significantly increased compared to resonance culture in high glucose medium without neurotrophic factors. Thus, BDNF, NT4, and citrulline promote neurite regeneration. This slide shows represented pictures of caspase-9 staining of cultured regions. In resonance culture in high glucose medium, panel C, and the number of caspase-9 positive cells was significantly increased compared to resonance culture in normal glucose medium, panel A. And the neurotrophic factor reduced the number of caspase-9 positive signals, panel D, E, F. Thus, caspase-9 immunopositive cells were increased in high glucose exposed retina. This slide shows caspase-9 immunopositivity in the ganglion cell layer of all groups. In resonance culture in high glucose medium, the number of caspase-9 positive cells was significantly increased compared to resonance culture in normal glucose medium. And in resonance culture in high glucose medium supplemented with BDNF, NT4, and citrulline, the number of caspase-9 positive cells was significantly decreased compared to resonance culture in high glucose medium without neurotrophic factors. Thus, immunopositive signals of caspase-9 were decreased in resonance with BDNF, NT4, and citrulline. This slide shows caspase-3 staining of culture regions. In resonance culture in high glucose medium, the number of caspase-3 positive cells was significantly increased, panel number C, compared to resonance culture in normal glucose medium, panel A. And neurotrophic factors reduce the number of caspase-3 immunopositive cells, panel D, E, F. Thus, caspase-3 immunopositive cells were increased in high glucose. This slide shows the caspase-3 immunopositivity in the ganglion cell layer of all groups. In resonance culture in high glucose medium, the number of caspase-3 immunopositive cells was significantly increased compared to resonance culture in normal glucose medium. And in resonance culture in high glucose medium supplemented with BDNF, NT4, and citrulline, the number of caspase-3 immunopositive cells was significantly decreased compared to resonance culture in high glucose medium without neurotrophic factors. Thus, Caspase-3 immunopositivity was decreased in retinas with BDNF, NET4, and scoring. In some cells, caspase-9 immunopositive signals were detected in the cytosol. However, in many cells, caspase-9 immunopositive signals was detected in the nucleus. This means active form of caspase-9 is translocated from the cytosol into the nucleus during the process of apoptosis. In summary, under diabetic conditions, retinal ganglion cell death is increased and the regenerating new rates are decreased. And mitochondrial and caspase-dependent cell death pathway is associated with neuronal cell death under diabetic conditions. And BDNF, NFT4, and scoring have neuroprotective and regenerative effect under diabetic stress. Now, development and accumulation of neuronal cell death are irreversible changes. And these changes are accelerated by vascular abnormalities or repeated anti-VEGF therapy. The first choice of therapies for retinal ganglion cell neuropathy is to reduce DM stress, such as controlling blood sugar level. Neuroprotective and regenerative therapy is not a first choice, but a second choice of therapies for retinal ganglion cell neuropathy. And neurotrophic factors such as NET4 is essential for neuroprotection in addition to axonal protection of retinal ganglion cell neuropathy in diabetic retinas. That's all. Thank you for your attention. So,